Welcome to Focus on Health. I'm Joe Gum. We appreciate you joining us. Millions of people in the United States have diabetes, and most of them suffer from type 2 diabetes. While there is no cure, there is a program for type 2 diabetics. It's an approach that can lower and stabilize blood sugar levels and help a person lose weight through diet, exercise, and supplements. Joining us today is Dr. Jade Malay to talk with us more about treating type 2 diabetes. Welcome, Dr. Malay.
Thank you for having me.
Now, can you explain to us why type 2 diabetes is increasing at such an epidemic proportion?
Well, not to mention our lifestyles and our poor diet, but the main reason why this is increasing ever so more across the United States is because the cause of the disease is never identified. So just with any problem, and to have a solution to that problem, you have to figure out what the cause is. And with this problem, we must figure out as to why someone's blood sugars are not being handled correctly. So that's where we have to start.
So a lot of folks right there listening or watching are saying, okay, how are you here to help?
Well, when you come into my office, we start with a thorough comprehensive diagnosis, because to get this disease beat, that's what you need to do. So it's not just looking at the pancreas, but it's also looking at the liver, the thyroid, and the adrenal glands, which have a very close relationship with blood sugar levels. So with this problem, it's like peeling an onion. You have to peel all the layers back with each person to figure out what is going on, what is not allowing their biochemistry to work properly, what is not allowing their body to handle blood sugars correctly, so we can get the problem solved and get their lives back.
Well, and that's the thing, what you just said, basically peel the onion, because a lot of my friends are going to see their doctors and they say, I think I have type 2 diabetes, and all of a sudden it's like, well, okay, I see the symptoms, but there they are, here's the medication, see ya, next. You know, and it's sort of like a cattle call, like you're in and out basically without no explanation on how to help this.
Exactly. So the typical scenario that I see is someone goes to their doctor, gets a simple blood test, is told that they have high blood sugar, here's this pill, watch your diet and exercise. And that's about it, as you said. But that's not enough instruction to get this problem taken care of. So with my office, we have to look at the person as an individual, and we have to customize a plan to their individual needs. For instance, not everyone can have the same diet. Not everyone needs the same exercise program. Not everyone needs the same exact supplements. So with this problem, we have to look at each person with their individual needs, treat that at the causative level, figure out what that problem is, spend the time with the person to figure out what is causing this disease, treat that, and that's when we start to see these levels, the cholesterol, the blood sugar start to naturally fall. I'm reminded of this person who I'm currently treating now, and when he came in, he was over 350 pounds, his blood sugars were over 300, his triglycerides were through the roof, and with my approach, finding out what is causing his diabetes, we were able to lower his blood sugars now to within normal range. His triglycerides are within normal range, his cholesterol is within normal range, and when he went to his doctor took him off half his medication, and to this date, just in 60 to 90 days in my program, he's lost 60 pounds. So he has his life back, and he's on his way to becoming non-diabetic. What
a great story. And I used to work with a guy, sort of the same thing. He was in his 40s. He said he had a poor diet for 20-something years. He was in broadcasting, so he was always on the go, and he has it. Now it's taken care of. But here's the thing. A lot of stories out there aren't so successful, but you've been able to have a ton of people who are successful, and like you just said with that story. Now, what are the standards when people come see you? Because they're pretty strict, right?
Well, what I'm looking for is someone who's motivated. That's the main criteria, because to go through this, you have to be motivated. Motivated enough to make changes in your life, motivated enough to do what I ask you to do, and motivated to want to stick this out and really put an effort into this. You also have to be taking your diabetic medication that you have been prescribed, because I work with your prescribing doctor. That's a very important part of this. I just don't take you off all your medication. That's not how this works.
Well, we appreciate you joining us today and filling us in on what you do at your practice. I know a lot of people out there are going to get in touch with you, and we appreciate her joining us. This is the offer, the latest in the successful treatment of type 2 diabetes from Dr. Jade Malay. You can call her today at 972-492-0383 or visit the website at drjademalay.com. The first 25 viewers who call and mention this Focus on Health segment will get a complimentary consultation. That number again is 972-492-0383. That's a $245 value. Dr. Jade Malay paid for this segment. We appreciate you watching. For Focus on Health, I'm Joe Gum. Have a great day.